This episode is sponsored by Grow Therapy. Grow Therapy was founded on the belief that quality mental health care should be accessible. It makes finding an in-network therapist easy. Go to growtherapy.com to find your match and let insurance pay for your therapy.
Welcome to a place where you'll leave feeling whole. The Counseling Podcast brings at-home counseling right to you, focusing on self-care, self-expression, and breaking down barriers. Dr. Jaclyn and Dr. Stokes bring over 20 years of combined experience and a new sense of style to the word counseling. The two use humor and lighthearted conversation to explore these deeper feelings. Let's take the stigma away from counseling together.
Welcome to the Counseling Podcast. Today we have a special guest, Dr. Amanda Weston, talking about gaming disorders. Hi, Amanda. Thank you for joining us.
Hi, thank you guys so much for having me.
You're welcome. Please just tell everyone where they can find you and what you do.
Absolutely. Well, you can find me on LinkedIn currently. I will be having a website all to myself soon, but that is in development. So you can either reach out to me on LinkedIn or ResearchGate. And I'm also on Grow Therapy as a practicing therapist.
Perfect. So let's kind of get into this gaming disorder. I was really excited to have you on because me and Jeremiah have kids. I have a 10-year-old son, soon to be 11, and I don't know what particular ages you work with, but I do know that gaming and technology is a huge thing right now for kids of all ages probably. So kind of, tell us what that's about.
Absolutely. Well, first off, yes, I do work with various ages, anywhere really from 8 years old on up. And we see what we call problematic gaming behaviors a lot of times in younger kiddos. So we usually start seeing these behaviors. And what I mean by problematic gaming behaviors is really just a broadly defined term of gaming that causes some type of impairment in some way or some type of distraction or distress from like real world functioning. So that could be like school, that could be if they're older work, that could be social relationships, like maybe with mom and dad or friends. And so we really see this at a younger age, probably around, we start seeing these symptoms around maybe, nowadays it's probably a little earlier, but we typically see them maybe around 8 years old and on up, and they gradually get worse as depending if they're, if we actually do something about them around the teenage years, and they start to taper off after young adulthood. So really, I think there's with gaming disorder specifically, because there's two different types, right? So there's problematic gaming where it's still an impairment, but it's not official criteria in the ICD-11 as they have it in there now. But gaming disorder itself would be if an individual is playing like 9 hours a day over a year span with multiple impairments. So that would be the official diagnosis.
Okay, perfect.
And I know that's such a big, as Jaclyn alluded to, it's such a big thing for the youth. And, I work with a lot of adolescents. I have in my whole career, and young adults. And I've just throughout the last 15 years, I just continue seeing an uptick with, problematic gaming and gaming addiction. Could you talk a little bit about what's the difference between a healthy hobby of gaming, which we know it can be, some people love gaming and it's like any other hobby, right? What's the difference between healthy gaming and unhealthy problematic gaming?
That's a great question. So basically, when we're looking at gaming, there's both positive and negatives, of course, to pretty much anything. And with gaming, what we typically see in something that you would classify as healthy would be looking at, are they learning open communication and an ability to work as a team and collaborate with others? Especially nowadays, as you've probably seen in your practices or just even with your own children, gaming can be very social in that aspect. And so they're always playing with friends or they're meeting new people online, which again has its caveats too. But really saying, open communication and healthy communication. Are we seeing them cursing? Are we seeing them getting really angry or rage-induced when they're playing? That would be something a little unhealthy. Looking at, are they having healthy boundaries with gaming? So what does gameplay look like? Are they de-stressing or are they really stressed out after a gaming session? how often are they playing? So what's the time spent? Are they playing for long periods of time? Or are they playing for short spurts, and then they're able to get up, go do something else, maybe homework or other things, when asked to or when prompted to, or maybe even without prompting, right? Maybe they can go to bed on time and do all the things we hope they can do. And then are they taking breaks? Are they incorporating exercise? Are they just really, are they following the rules? Are there time limits, et cetera, and so forth? And are they following those? And if they aren't, and you're seeing this impeding on their ability to function in different aspects of their life, then that's where we would have concern.
Yeah, and I know for my son, just to on a personal level, I allow him, he knows there's a certain time in the day that you get to game with your friends. And like you said, it's a social. So I don't mind it so much if he's, talking with his friends, they're problem solving, right? And it's for a specific time. But for the clients that I have that some parents don't have those boundaries or don't know how do you work with the parents to implement these healthy boundaries, or even, work with the client themselves who is gaming too much?
That's a great question. So really focusing on what do we want it to look like? So a lot of times with gaming, I think a lot of parents forget that it's so fun, and we typically want to do something engaging that really just promotes, whether that's being social, as you said, or whether that's just something it's usually a lot more fun than homework or other types of school activities. Unfortunately, maybe we'll get, there somewhere. But we typically want to make sure that we understand, why are they gaming? So is this a coping mechanism? Is this for something else, whether it be anxiety, depression, stress, etc.? And is that really their only one that they're using? And so they're using more frequently because that's all they know. Is this a way to avoid? So are they avoiding responsibilities, such as maybe they have chores to do, or maybe they have other things that they need to be getting done, but they'd rather be gaming, understandably, of course, sometimes. And then are they, really, are you seeing any detriment in that way? And so if parents are seeing this, some things that they can do is kind of like what you already said. So time limits. Are there any time limits set? Are there any rules to the internet use or gaming? Because internet is the same in that regard too, where we need to just keep an eye out on what we're doing and why we're doing it. And really involving the whole family in treatment. So when I work with any type of client, whether it's the individual who has problematic gaming behaviors, or it's the family that comes in and says, hey, I really just need to learn how to navigate this, involving everybody. So is the family also playing games with them? And do they understand the gaming process, right? Is there a way to incorporate that so that it's a fun time together rather than something that should be banned altogether? Because I hear a lot of parents saying, oh, I just want to reduce it completely. I don't want them playing because they are having trouble with regulating it. And it's like, well, why don't we have some balance or some moderation? So really promoting that. And I tell a lot of parents too, can we incorporate other outside activities that are also just as fun? So can we plan some exercise throughout the day, or, after school or something like that? And then I also talk to parents a lot about promoting really important habits. So like sleep hygiene is so important, especially making sure there's no screen time an hour before bed. I think a lot of times we get very attached to things like technology right before bed too, and kids are no exception. So making sure that they understand promoting healthy habits and modeling those habits. So parents need to do the exact same thing that they're telling their kids to do, right? So that they're showing and role modeling those behaviors. And they're more likely to listen when they see their parents doing it too.
No, that's all great. And what about when kids are using it as a coping mechanism, or even adults too, to kind of zone out, and this helps me, to calm down. But then also some of the games can maybe even make you more angry, or more if they're violent. So how do you kind of balance that, where it could be a coping mechanism, but then they need to learn that you shouldn't really depend on that?
Sure. So a lot of times when I work with any type of client who's using gaming as a coping mechanism, I ask, what other coping mechanisms do you have, or what do you know about? Because a lot of times they don't know the grounding skills, or the mindfulness techniques, or exercise that's appropriate for them, or whatever it is. They really don't know, because gaming is so accessible and so affordable nowadays. So it's just a really easy outlet. I mean, you can even use your phone to game. So it's very easy for them to just have it wherever they're at. So if they're feeling really anxious or feeling really depressed or feeling whatever they're feeling, they can just grab it and go. So asking them first, what are the other skills, and are you willing to learn them? Because there's so many things that you can use while you're out and about that's no cost, essentially. So you don't really need that. So focusing on building those techniques over time, and even using them while gaming. So if the gaming is becoming really just really unhealthy, or just it causes stress rather than de-stressing, using those skills in between gaming sessions. So I'll have clients play certain types of games, and then we'll practice those skills in time, like as they play, so that they're learning those skills as they go, rather than kind of just assigning it for homework and hoping that they use it. So being able to give them feedback right away rather than waiting and seeing if it works, has been really helpful for them too.
Wow, it's amazing to hear you talk about all the details associated with this, and it really shows just how complex this issue is, right? Because it's like, okay, so there's this idea about having healthy gaming and what that can look like in your life, but then there's this problem gaming that can be really complex, that it can involve family, it can involve a lack of coping, it can involve some really, what I'm hearing, some deep underlying issues that are leading the individual to cope in that regard. I'm curious, how do you handle, so like when I work with people, and this is not just young people, this is people in their 40s and 50s. Let's make that very clear to our audience, that this can impact anyone, right? Dr. Weston?
Yes, absolutely. Yes. Actually, 65% of adults age 18 or over are gamers. So yes, definitely.
There it is. How do you deal with somebody who maybe doesn't want to look at the fact that it's a problem, right? So I get a lot of folks who come in and like, it's a lot like chemical addiction, right? They'll come in and they'll say, well, yeah, I guess, my wife or my husband is a little upset with me because I'm playing a lot. Or a young person says, yeah, my parents kind of get on me, but this is my world. This is what I love to do. How do you address that?
That's a great question, Jeremiah. So I think that there's a couple different ways to tackle this. One, really gaining insight into whether it's the spouse or partner or parent, whoever it is that's kind of asking those questions of how to like navigate that, what their idea of gaming is. Because a lot of times if we have a bias toward gaming or don't really understand why, then that could impede any progress of kind of bridging the gap between the gamer and the person who is trying to assist them with their problematic gaming. So really, one, focusing on that. Two, building insight with the gamer. So, and again, you're right. So it doesn't have to be a kid. It can be an adult too. And I've worked with plenty of adults who have had this issue, where we build insight. So it's like, okay, I understand that you really love this mode of entertainment and you find this really helpful for de-stressing and or building relationships, et cetera, and so forth. But I'm noticing that we're having XYZ behaviors. Tell me a little bit about that. And so really using like a motivational interviewing approach, just to kind of gain insight and to see where they are in the stages of change as well, which you would do in any type of substance use disorder as well. So looking at that, and then really just once they have that insight or they're able to say, okay, yeah, maybe this is a problem, being able to then go, okay, what are you willing to do to work on it? Because if they're not very willing to work on it, it's very difficult to push them or motivate them to do something. And so really just taking a little slower approach with that. They typically, in my experiences, have recognized something's wrong or there is some type of impairment. Now it's just building up of, okay, what can we do about it? And giving them actual tools to handle it. Because if they just see that this is the only thing that they have, then typically they'll just keep going back to that. And so just really building their skills, their tool sets, and being able to say, look, there's another way of doing this. So how about we try this and build a more balanced way of living?
Excellent.
Really being aware and, of all the stimuli around you and kind of using that correctly rather than depending on something, more so of like, okay, I can, fit this into my schedule and not feel like I have to do this all the time and do something else. And this is still going to be here for me when I, want to play it. I don't have to play it excessively.
Exactly. And I think too, a lot of people, when I start working with them, or at least parents, or older folks too, tend to go, well, why can't I just take it away? Sure, it'd be really easy to say, yeah, let's do that. But at the same time, there's so many ways to actually access it that it's very difficult to just take something away completely, especially with any type of internet connection or technology use, because we use technology in so many aspects of life. You have to pay your bills now on technology. You sign up for doctor's appointments through that. And so it's so difficult to just say, oh, let's abstain from it, when really you can access it anywhere and it can shift into other things. And so really just teaching the way to balance and be able to integrate it into more healthy behaviors is so important, to teach to families or partners or spouses as well.
Yeah, I like that. I like teaching the healthy relationship with something, because if you take it away, you're saying it's like you have to be defiant, and then kids are going to be like, "Well, I want to play with it because you're telling me not to." They're going to want it even more, or even adults too. Like, "Oh, I can't do this. Well, now I want to." So let's form a
Absolutely.
healthy relationship rather than it's forbidden.
Yes,
Yeah.
absolutely.
And you mentioned like it's not going anywhere, right? I think that's another thing that makes this sort of complicated, is that there's no roadmap to this for mental health providers, for families, for even the gamers themselves. There is no solidified roadmap out there. I mean, at least with like other types of problematic behavior and addiction type stuff, there's, we've been studying it for a long time, right? Even though we've been, not that it necessarily helps all that much, because we know that a substance abuse recovery is a very challenging thing in and of itself, but at least we have a
Yes.
roadmap. Whereas with gaming, this is all sort of unfolding, and it's cultural, it's societal, it's our world now. What have you noticed that as well?
Yes, gaming has been such an integral part of just growing up for digital natives. And when I say digital natives, individuals that have grown up with technology over time. And so it's not going anywhere, as you said. It's a $1 billion industry globally, and they've incorporated it into even work. So being able to be a streamer or being able to competitively game, those are really important to understand, that people are going to gravitate toward that too. And so if you're taking away their opportunities for work, that's also something to consider. Like that could be a way to gain revenue, and or something that somebody really wants to do later on. And so it's being, like you said, integrated into daily life, and it's not going anywhere, and it's evolving constantly, especially with VR and things like that. So being able to even integrate that into our practices could be really beneficial for people who are gamers that are coming to seek therapy.
Yeah, that's really interesting to kind of, if you integrate that into, maybe even coping mechanisms or different treatments of kind of getting them to kind of implement that into their life and practice that with that spin on it.
Yes, there's actually a couple of games out there now that have been used to, whether that's for trauma, whether that's especially for PTSD, whether it's for anxiety, depression. They actually have games out there that could be used in tandem with therapy to help reduce those symptoms. VR too. I mean, I've used VR and other games for exposure therapy with my OCD clients as well. Being able to just integrate that has been really helpful and meaningful for my practice. So it's out there, and it's becoming a really big thing now.
That's fantastic to hear about, ways that we can utilize gaming to kind of optimize mental health, and, working through some of those challenging issues and disorders like PTSD and OCD, and knowing that there's a place for of therapeutic value with these games. On that note, a question I want to ask you as an expert, because I hear parents ask me this all the time. As you know, the first person shooter games are a fan favorite, presumably, right? That's a common one.
It's a very common one,
It's a
yes.
common one. And parents will come to me and they'll say, look, my son spends 5 hours a night shooting other people and zombies. And then they ask me, they say, do you think is this going to affect him? Is this going to make him violent? Is this going to desensitize him to gun violence? And what are your, as an expert who's done a lot of work in this area, what are your thoughts on that?
That's a great question. So I think that there's two sides of the coin at this point, where we've seen some research studies saying, oh, there's a correlation between violent video games and violent behaviors. We've also seen a lot more research saying there isn't a correlation. It's really, there's so many other factors that are impacting. Video games don't necessarily cause violence. I'm a little bit on that side in terms of not causing violence. There's actually a lot of benefits to first-person shooter games, even though it doesn't seem like it. But there's a huge research study that was done internationally. I'm trying to think if it was Sweden or Finland. I apologize, but I will make sure that you guys get that information. But they basically did a research study looking at what are the benefits to first-person shooters, and they found that they increase hand-eye coordination. They're able to multitask better. They were better able to pick out certain details in a very fast-paced environment. So able to just kind of pinpoint those things where other people couldn't. And so there's a lot of teamwork, collaboration is also something that they talked about too. So there's a lot of benefits to it, but at the same time, there is a valid concern of, is this going to desensitize my child to the issues in the world, right? And I usually tell parents, what it isn't at this point, because we're seeing a lot of media, we're seeing a lot on social media, especially with these types of events unfolding in the world, or just in general. It's already starting that process. So I don't know if video games are necessarily causing that much of an impact compared to seeing it every day through our phones or through the news or through any of those. But still valid concerns. But I typically will tell parents, like, give them breaks. So making sure we adequately also talk about it too. It's like, okay, this is a fictional world, even though it may be based in reality in terms of like Call of Duty being, world wars and things like that. Really talking to them about it and saying, what do you get from this? Like, what exactly is the purpose of you playing? And a lot of times kids, especially, or teens or young adults even, will just say, it's a game I play with friends because it's super easy, like to play, and just, it's something where I can play quickly. So I don't necessarily see a lot of people going, oh, this makes me really want to act violently towards somebody else. That it can actually be a way to de-stress from those urges from research, as they've shown. So again, valid concern, but however, there hasn't been a lot of research to prove that is actually something that should be really focused on at this point.
Great explanation, right? And again, pointing to the complexity of this issue. It's that there's actually some benefit here, and but there's not really any research necessarily concluding that if a child or an adult plays a first-person shooter game, that they have more of a proclivity towards violence. And I think that's very important. And you make another valid point, which could open up a whole other discussion, is what isn't in this world exposing our youth to the realities of our society. So that's all really valid.
And then it's just, understanding how your child or your spouse handles different things, like how mature are they? Do they are, on an individual basis, like my child can handle like an hour of this because they're mature enough to kind of recognize this is fake versus, and doesn't really, whereas other children maybe get more upset or stressed when you take that away from them, and they have a different relationship with that. So it's really just knowing, what you need and what kind of coping you need individually.
Absolutely. I think also too, you bringing up a great point that you should know your children, but also keeping in mind of rating systems are really important as well. There's a purpose to a rating system in gaming. And so if it's something that's mature, 18 and older, we may, think a little bit more about buying our children those games, because they may not be, it's not age appropriate per se. And so one, understanding where they're coming from with playing these games, but two, also recognizing that having them play age appropriate games is also really important, so that they're not necessarily being overly exposed to things.
Sure. Yeah. Checking in with your child or your significant other to kind of say, what are you playing? And am I seeing any warning signs of anything?
Mm-hmm.
And it sounds like it points to that same argument about, the importance of an individual needing to be balanced and, to have well-being in their life. They can't give too much to one particular area, whether that's gaming or any other behavior. And in fact, there may be some benefits to a little bit of it, but we just don't want to overdo it. So for our listeners, before we wrap up today, Amanda, tell us, when should someone say, hey, I need help, or my family member needs help, and how do they go about that process?
That's a great question. So in terms of the warning signs, really looking at, are you noticing issues in activities of daily living, for example, which means, are they, having appropriate hygiene practices? Are they grooming themselves? Are they paying their bills or completing their responsibilities at school or work? Are they doing the things that they need to do to function daily? That's one of the biggest indicators, is they stop doing certain things. Also looking at, is there impairments in certain other types of functioning? So whether that's socially, so are they only focused on gameplay, or are they, getting out into the world and doing the things that they need to do socially? Are they avoiding certain types of tasks or responsibilities, like going to work or being late for work? So seeing just issues in that realm of occupational functioning. And really looking at, are they, because gameplay doesn't necessarily denote issues, because if you look at competitive gamers who do this for work, they play a long time every day. And so really looking at, okay, if they're playing a lot, what's the purpose of this? And are you noticing their mental health declining? Are they, exhibiting more rage or anger, frustration, depression, anxiety, those types of mental health conditions that we really need to be aware of? Are they exhibiting that more, especially after gameplay? And are they having issues getting off of the game? Are they really just hyper focused, and do they tend to have withdrawal symptoms, such as, again, anger or sneaking behavior? So are they playing behind and not telling anybody? Things like that, where we really need to notice, okay, this seems to be a problem. They're not doing what they need to be doing, or they're really struggling in their life. So that would be some of the warning signs. And then in terms of getting help, it has been really difficult to navigate the systems in the United States, because globally we have treatment centers and we have research centers and things like that, where they're really focused on this issue, especially in Korea and Japan. However, in the United States, it might be a little harder, but there are certain treatment centers out that are helpful, as well as individual therapists who have gotten trained or do research in this area that you can go to. I know sometimes Psychology Today has indicators of like video game addiction, specializations. That's really important. Seeing any types of, there's a couple in Florida specifically that have really focused on just gaming in general, and they have residential programs. But there's not a lot out there, but that doesn't mean there isn't something out there. So really just looking at, is someone saying that they're specialized in it? What are their credentials? So really looking and talking to them as well, using your free consults and things like that to see what they're using, and really focusing on therapeutic interventions that have shown evidence-based, which means there's research backing that up. So like cognitive behavioral therapy, family therapy, and things like that, really to promote better, healthier behaviors.
That's great. That's amazing. I love all the information you shared with us, and we're going to put your links up for our listeners. They can reach out to you, or they can go to your sites for more references. We just want to thank you, Dr. Amanda Weston, for coming today and giving this knowledge, and we hope you can come back and share more.
Thank you so much.
Thank you so much for joining us here today on the Counseling Podcast with Dr. Jaclyn and Dr. Stokes. Please take this time to thank yourself for putting in the work. If this episode impacted you in any way, let us know with a loving and honest review. If you have any questions or want to continue the conversation from today, you can reach out to us at thecounselingpodcast@gmail.com, and we can answer your questions right here on the show. Or you can find Dr. Jaclyn and Dr. Stokes on Instagram at DocJaclyn and at dr.jeremiah.stokes.